Right, hi Nadeem. This is Robert here. Just going to go through your scan. Thought it'd be useful just to do a little walkthrough of your MRI scan. So I've got the images now, as you can see. So on the left-hand side, this is a picture of your spine inside of you, so sideways. I'm going to start off at this one here. This is the L4-5. This is the one where they've mentioned that you've got some stenosis. Now, this little wiggly line here means that that's a little tear in the disc, which I'll talk more about in a minute. On the right-hand side here, this image here is a cross-section of the spine. So imagine if you sort of chopped yourself in half and were looking up from the bottom upwards, this is the view we'd see. And this is actually just basically a view of the very top part of the L4-5, and this is kind of how it should look. Slightly almost kidney-shaped disc here. These are the hip flexor muscles on the side. These are the back muscles at the back here. And these little dots here are the nerve endings which are going down towards the legs. Now, as we come down the spine, that still looks okay, but then you can see here, this starts to become a little bit crowded. And this is they're talking about where the stenosis is. This is the canal, this is the spinal canal, and this is where it's getting a little bit crowded. However, the good news is that you haven't got what we call bunching up of the cauda equina. So the nerves that are coming down here are nice and straight. They're not wiggly and bunched up, which means, as I said to you yesterday, that you're probably not getting too many symptoms. Well, in fact, your description of your symptoms didn't really indicate this being a level being a problem. It might explain if you're getting some back pain, could be coming from that tear. It is something for us to keep an eye on because we don't want it getting any worse, certainly. But for now, I think what's probably happening is that if we look at the disc below, so this is now looking at the L5S1, we just got, well, you'll see it more on the cross-sectional view, on the axial view, as I flip to this image here. And as I navigate down towards it here, now that's showing the right and the left nerve roots. As we come down, though, we can see that it's a bit of a bulge here. Now we can see here that's the S1 nerve root on the left, but we can't see the S1 nerve root on the right, and that explains why you're getting some right-sided leg pain. And it's that disc which is bulging slightly over to the right, and it's hitting that nerve. And in fact, if I go a little bit lower, we can just see the nerve emerging here, just underneath the disc. Now that's quite swollen. If you see that's the nerve there on the left, that's the nerve there on the right. It's actually quite swollen. So, no doubt about it, this is an L5S1 impingement of the S1 nerve root on the right-hand side. Now, things, obviously, yes, IDD can potentially help this disc. The traction can potentially help the disc as well. I think we should try and start with that. The fact that you've got some swelling in the nerve means we want to ideally add in something else called tachytherapy. So the tachytherapy is an electromagnetic form of treatment which helps to reduce the swelling in these deep structures in the canal here. Things like laser and ultrasound won't go deep enough, but the Teca will. The other option you have got for that, though, which we probably would respond quite well to in terms of pain relief, would be a cordal epidural or even a nerve root block if they can get to it. But a cordal epidural is something that the doctors might offer you at the hospital. Wouldn't be a bad idea. The downside of the cordal epidural is that it doesn't really help the underlying disc bulge. It just takes away the swelling of the nerve. So you're not necessarily treating the cause. However, I think so. Therefore, in terms of non-invasive measures and treatment that we can offer you, certainly our clinic, the best thing would be the IDD. The next best thing would be the other traction machine that I mentioned. We do want to have a look at these muscles here. As I said, assess you and feel you in clinic, but that might need releasing off. But we certainly need to think about that disc, because that is definitely ultimately what's responsible for your symptoms. Just on the talking about other things we might think about muscle-wise. So your muscles here at L4-5 are actually in quite good nick. The ones at L5S1, a little bit of white sort of fatty infiltration going on here, but not excessive. You often get that at that level. So muscle-wise, you aren't too bad. I did notice, however, if you look at this here versus this here, there's some asymmetry in the hip flexor muscles. So the one on the right-hand side could be tight, or the one on the left-hand side might be weak. So we might want to be looking at that as a slightly longer-term picture to try and address the overall mechanics of your spine and get the health of your spine as good as we can do. So that's just somebody mentioned something that we might talk about in the future. But certainly the immediate priority, I would say, is to try and get that pressure off that nerve, and that would involve the traction styles of treatment. One other thing that I will just show you is the nerves which are coming out from the side of the spine. So these are the little nerves that are coming out from the side here. So we can see these nerves coming through here. And it doesn't look like the L5 nerve's getting pinched. So that's good. I think it is just the S1. So I think they've mentioned that anyway in the report. So from that point of view, it makes our life easier because we've got to concentrate on the one disc. And as I said, tractioning this disc will have a mild spillover for this disc. There might be at some stage that we want to be doing something, different angles on the IDD machine to target this disc as a preventative thing. But for now, certainly priority number one is homing on this level and trying to take that pressure off that S1 nerve. Anyway, hope that helps.